So my name is Eric Enloe. I am the president and owner of Centurion Logistics and Spartan Logistics. We are a trucking company that we're spread out over most of the United States. We were with a traditional healthcare plan, had several options, your basic co-pays, deductibles. So the biggest issue we had that initiated was cost. We had gone through about 3 years of 20 to 25% increases in premium cost. As a company, couldn't afford to eat that cost, and also our drivers were getting to the point where they just couldn't afford to cover their family, and that was problematic for us. We started looking around for alternative options. I met with multiple people here at Redirect, and they weren't just doing it how everybody else was doing it. They were challenging how healthcare works. Why I chose Redirect was twofold. The cost savings, but the bigger reason was the care team. Our employees could call and help coordinate healthcare, and if I'm by myself and I'm trying to coordinate care for myself or for my family, I don't know all the ins and outs. And so having a team that can do that for me, that is where healthcare needs to head. We cut our premiums from where they were going to be by, I think, 60%. So that was huge. Basically, for us, that is a huge thing on multiple fronts. We could just say, hey, we cover 100% of healthcare, and that's a big tool in recruiting, retention, all those things. Yeah, I mean, it's one of the things in our industry that you can differentiate yourself on as a trucking company. There's a lot of options and there's not enough truck drivers. So our ability to offer that and say, hey, it's 100% covered for a single driver, then it's a big thing in a very competitive industry. The care team is a big thing, and when we went to it, that was our biggest thing. Yeah, cost was important because it was becoming prohibitive to where we were going to have to potentially not offer insurance. The care team really got us to the point where we felt like it was not just less expensive, but it was a better quality of care because we had someone that we could call and help. And when there were questions, you always had, it wasn't just a question to your doctor. You could go back to Redirect and say, hey, can I get a second opinion? Can I do some things like that? So because Redirect was doing things differently, they could offer a higher level of care because they were involved in everything. Free chiro has been a big hit for some of our guys that use it. I personally have used it, and I've never been a big chiropractor guy, but it's great. So that's a big one. The virtual care, I mean, being drivers, a lot of them are over the road, so they may be based in Kansas City, but they find themselves in California or New York. They're all over the place. And so having that it wasn't necessarily a local network dependent plan really helped our guys. But medications and things like that Redirect helped find solutions through government programs and through programs directly with pharmaceutical companies to help reduce costs, sometimes 90-95%. Yeah, the app's been great, especially, and even where there's issues where they've got to submit something, either a bill or an invoice that has come, just being able to open up the app, take a picture and send it has helped as well. I mean, it helps. Obviously, we can plan around that, and for us, we know we can plan what our contribution is as a company, and it's at least, I would say, 50 to 70% savings, and for better care. And for our employees, they know where they're going to be at, not just this year, and I'm sure there'll be increases over time, but we're not seeing that consistent, just double-digit growth in costs every year. I think Redirect is, I just love that they're trying to do things different in a world that not very many people are doing that.